Ross, I need to tell you something.
Well, what's the problem? You having second thoughts now? You don't wanna...
I do. But I want to be with you. But I want us to get tested first.
Tested? Look, babe, I'm good. I know I haven't got anything. I've only been with clean women.
Sexual health tested. Especially HIV, babe.
What? No.
What? Oh, you mean gay? You don't have to be gay. Listen, anybody can get an STI and anybody can catch HIV. It doesn't matter about your sexual orientation.
Listen, babe. I'm good. I carry myself clean. I don't need no checkup for no STI. My thing's good. Trust me. Why are we even talking about HIV anyway? It's not 1982.
Well, exactly. It's not the 80s. Things have changed. These days there's more information and medication. There's even a pill that prevents you from getting the infection. Did you know that? We need to let go of these myths and stigmas. My auntie would still be alive if...
Wait. So your auntie died of AIDS? But what's that got to do with you? It's not cancer. You can't inherit it, can you?
Of course not. But losing somebody close to me made it real. It made me want to do everything in my power to protect myself and other people as well. So whenever I get a new partner, I test. I always have and I always will.
Yeah, but what if you find out that you got it?
It's better to know. And one can live a long and full life now with the infection. But the trick is to catch it early.
So you're suggesting we go to the clinic? But what will people think if they find out?
I know it's awkward going into a clinic, but it's for a reason. To check in on yourself and get treatment. And the beauty of modern times is you can order a home testing kit. I've already ordered mine, so it's discreet and nobody has to know. I mean, you still want some of this, don't you?
Come on then.
If you're sexually active, you need to be sexually responsible. If at any stage in your life you have had sexual contact with another person, in doing that you do, whether willingly or unwillingly, you put yourself at risk of contracting STIs. That includes HIV, chlamydia, gonorrhea, all of the rest of them. So if you've done that, you need to be sexually responsible for yourself and make sure that you're testing to make sure that you are safe to continue having the safe sex that you want, but also to make sure that you're protecting other partners if you are having sex with other people. And if everybody was doing that, then we would be in a nice, safe and loving environment.
It's really, really important that people know their HIV status, whether they're negative or whether they're living with the virus. And the reason that's important is to make sure that they get treatment and that their virus is managed. If it is unmanaged, it could potentially lead to AIDS. And there is absolutely no reason in this country that people should be dying of AIDS. The NHS offers full testing and treatment to anyone.
HIV is no longer a death sentence. People live normal lives with HIV, but it's important to get treatment early.
Bristol is a unique place, but the statistics of HIV is rising among Black, African and Caribbean heritage. What are the reasons?
Bristol has higher rates of HIV than other cities within the UK. We know that, we've seen the figures, we've seen that that's a problem. We also have higher rates of late diagnosis within African and Caribbean heritage communities. So those are the things that we really needed to tackle.
Common Ambition Bristol is a 3-year project funded by the Health Foundation, and it's aimed at improving sexual health services for African and Caribbean communities.
What it really means is a lot of organisations coming together to achieve 4 main aims. Those aims are increasing HIV awareness, increasing HIV testing, decreasing stigma and decreasing late diagnosis. All of that is within the African and Caribbean heritage populations here in Bristol. So it's a unique project. It's running for 3 years. It's an absolutely incredible project and everybody's coming together to really make it work.
For me, that is a really exciting part of this project. It's about members of the community telling us, because they are the people who are using services, we need to hear what they think about services and then working hand in hand with professionals and everyone kind of working together and bringing something different and their opinion so that we get the best possible services at the end of the day.
I know within my African community the stigma on HIV is there, and I want Common Ambition to get involved to get rid of that stigma.
I'm really passionate about reducing health inequalities for LGBTQ people and people of colour, and I think Common Ambition is really unique in what it offers and how it's involving the communities within that project. It's great.
My reason for getting involved with the project basically is because of our community, the BAME community, so that they can see me and identify with me, because normally we don't really identify with whites. So when you have somebody like me that they can see, they're more likely to come forward. So that's the reason why I get involved with the group.
So myself and my colleagues at university, we're working with people from Brigstowe, who are a charity that helps support people with HIV. We're also got really important community partners with African Voices Forum, but equally important is we're working with the NHS, we're working with Unity, who deliver the sexual health locally, and also the council as well. So it's about having the right people around the table to make change happen.
Bristol is what we call a fast-track city for HIV, which means it's committed to accelerate work to end HIV. So the council is actually responsible for commissioning HIV prevention and for commissioning sexual health services. So the results of this project will be really important for us going forward.
It's better to know your status rather than worry about if you are HIV or not. You can get tested and know if you are, you can get treatment and then you can be healthy, or if you're not, then you can live your life normally as well.
Basically everyone's at risk if you're having sexual contact. If you are, just test.
The Common Ambition Bristol project, which we want for it to become an household discussion, people to feel comfortable to talk about and to do the testing. Testing is very important.
When somebody comes into clinic, they'll come into, at the moment, we have a clinic in Charlotte Keel, which is a medical centre.
You can have a finger prick test on the day, and we just need to wait for the result in clinic, which is 20 minutes. Or you can have a test from your arm like you would at the doctor's, and then we would get that result to you in usually about a week.
I'm 54 years old, and it's important for me to be tested regularly. I like to know my status. For my own health and well-being, it's important to know that.
I've taken it before personally, just for my own personal awareness.
We need to be having those conversations. So, you know, even with the clinic that we've opened up now, whether you're young, old, ripe, green, come down to the clinic, come and ask those questions. No question is a stupid question. You're in a safe space. Come and talk to us.
Service can offer an alternative for people that don't want to go to get to outside of their area, but home testing definitely, especially for the older generation.
Of course, I will prefer home tests, and if I feel like that I have to get a test because word can spread so easily, I will go down Manchester or somewhere far to see if I get a test. You know, I'm not staying inside the community to get a test as such. I will much prefer home tests.
The kits are there. You don't need to even go to the hospital. You can apply, request for the testing, so it comes to your house and you test yourself and you know.
PrEP is something called pre-exposure prophylaxis. That's the long term for it. The short term is PrEP. It's affectionately known as PrEP everywhere.
So PrEP is a pill you take before sex and it can prevent you getting HIV. So people that may be at risk of HIV, by taking PrEP, you can get rid of that threat, you can get rid of that fear. It can really help drive down numbers of HIV. It's a real game changer.
That's news to my ears and sounds like a miracle. As far as I'm aware of the history of HIV and AIDS.
If you have a HIV negative diagnosis, if you don't have HIV, it's a tablet that you can take every day and it will stop you from getting HIV. If you were to have unprotected sex with somebody who either didn't know their status or wasn't managing their medication, it stops HIV from replicating in your system. So essentially it stops you from having HIV from a HIV positive partner. It's, you know, perfect if you're going on holiday with the man and you think you're going to have a wild week. Protect yourself. If you're in a relationship and you don't feel ready to have the conversation about using condoms, or you don't feel able for whatever reason, take this medication, protect yourself. If you are having sex with multiple partners, you know, if that's a lifestyle that you choose, take this medication, protect yourself. PrEP is all about protecting ourselves. Historically, people have thought that HIV is an African problem or a gay man's problem, and it's not for heterosexuals.
Some people say, my biggest fear is I'm going to have a gay man's disease. It is not a gay man's disease, it is a disease of people.
You can pick up HIV through any kind of penetrative sex, so vaginal sex, anal sex.
Cut out that stigma of HIV means you must have been dirty or something like that.
It's a problem for everybody. It's a problem for anybody who has had unprotected sex with anybody.
A lot of people don't have the knowledge that having HIV/AIDS is not the end of your life.
The really important thing as well now is that if you are positive and you're on effective treatment, you cannot pass HIV on.
You'll be able to have sex without a condom, you won't pass it on to your children, even if you have to blood on blood contact, if your levels are that low, or U equals U is undetectable equals untransmissible, you will not pass on the virus.
Just because you've got HIV doesn't mean it has to impact on your life at all.
It's just really, really important. If people are worried that they're living with the virus, that they get tested, and if they are living with it, get on treatment straight away.